Good day, everyone. So, today we're going to talk about a genetic disorder called autism. So, what is autism? Autism represents a broad group of developmental disorders characterized by impaired social interactions, problems with verbal and nonverbal communication, and repetitive behaviors or severely limited activities and interests. Autism has become the most commonly diagnosed childhood developmental disorder. According to the Centers for Disease Control Prevention in 2007, autism spectrum disorders now affect 1 in every 150 children in the United States. Statistics from the U.S. Department of Education and the other government agencies indicate that autism diagnoses are increasing at the rate of 10 to 17% per year. Did you know that autism can affect any individual and is not based on ethnic, racial, or social background? The incidence of autism is the same all around the world. It is 4 times more common in boys than in girls. Now we will talk about the symptoms of autism. Autism usually develops before 3 years of age and affects each individual differently and to varying degrees. It ranges in severity from relatively mild social and communicative impairments to a severe disability requiring lifelong parental, school, and societal support. The hallmark symptom of autism is impaired social interaction. Children with autism may fail to respond to their names and often avoid eye contact with other people. They have difficulty interpreting what others are thinking or feeling because they do not understand social cues provided by tone of voice or facial expressions, and they don't watch other people's faces to pick up on these cues. Many children with autism engage in repetitive movements such as rocking, spinning, twirling, or jumping, or in self-abusive behavior such as hand biting or head banging. So, how is autism diagnosed? A diagnosis of autism is based on standardized testing plus a clinical evaluation by an autism specialist. These professionals are usually psychologists, psychiatrists, developmental pediatricians, pediatric neurologists, or medical geneticists. When physical features, small head size, or brain malformations are present, or there is a family history of relatives with autism, genetic testing such as chromosome analysis and single gene testing is done. So, what is the treatment for autism? There is currently no cure for autism. However, autism can be managed and shaped at a young age, even as early as preschool. Early intensive therapy can have a positive effect on development later in life. Treatment of autism involves medical and behavioral therapies to help children with conversational language and social interactions. Treatment also involves helping children decrease the repetitive, self-stimulatory behaviors, tantrums, and self-injurious behavior. Medications can help treat specific symptoms, such as aggressive or self-injurious behavior, inattention, poor sleep, and repetitive behaviors. However, no medications are autism specific, and medications should be used in conjunction with a family-centered, behavioral, and educational program. So, is autism inherited? Scientists are not certain what causes autism, but it's likely that both genetics and environment play a role. The causes of autism may be divided into idiopathic, which is the majority of cases, and secondary, in which a chromosome abnormality, single gene disorder, or environmental agent can be identified. Approximately 15% of individuals with autism can be diagnosed with secondary autism. The remaining 85% have idiopathic autism. Researchers have identified a number of genes associated with autism. Studies of people with autism have found irregularities in several regions of the brain. Other studies suggest that people with autism have abnormal levels of serotonin or other neurotransmitters in the brain. These abnormalities indicate that autism usually results from the disruption of normal brain development early in fetal development caused by defects in genes that control brain growth and that regulate how neurons communicate with each other. These are preliminary findings and require further study. When the cause of autism is a chromosome abnormality or a single gene alteration, the risk that other brothers and sisters will also have autism depends on the specific genetic cause. So that's all. Thank you.